Thank you for watching this video on deep brain stimulation for epilepsy. There's a certain percentage of patients, about a third of patients, whose seizures are not completely controlled with seizure medications. And so they start thinking about surgical options. There are several different options out there for patients. And what we do is we tailor the right surgery to the individual patient's needs. And one option out there is DBS, or deep brain stimulation for epilepsy. And that's where you'll have these probes placed into your brain. And what they'll do is these probes will stimulate the brain and reduce the frequency and intensity of seizures. So the way this works, just to get into a little bit more detail, is a generator is placed under the skin. So kind of in your chest area, you'll have this little generator which is placed, and then there's a wire that will go from this generator, which is kind of the stimulating device. And as you can see in this cartoon, this will go up, and then a probe will be placed in the brain. So what a surgeon will do is surgeon will do a burr hole on this side and on this side, and then this probe will go deep in the brain. That's why it's called the deep brain stimulation, because these probes, they're very small probes, but they do go deep in the brain, and they go into an area of the brain called the thalamus. And this is an area. The thalamus is this area that's right in the kind of middle of the brain, and it allows a lot of generation of electrical activity in the brain, kind of a network in the brain that will produce a lot of electrical activity in the brain and can produce seizures. And so by stimulating the thalamus, it's a way to change the way the brain will have electrical activity and can really help with seizure activity. So the mechanism is not completely understood. One thing we think happens is when you stimulate the thalamus, certain brain chemicals called neurotransmitters can be released. And one of them is GABA, which can reduce the frequency and intensity of seizures. This slide goes over some of the neuroanatomy. And my main point with this is to give you a little bit of better idea of where the thalamus is, so that those probes would be starting here and going deep into the brain, into the thalamus. And all of this is the kind of circuitry. This just kind of tells you all the connections from the thalamus to all over the area. So this is the anterior thalamic nuclei, and that's where those probes are placed. And they have connections to places like the cingulate gyrus, mammillary body, hypothalamus, hippocampal formation, amygdala, prefrontal cortex, association cortex. It's not critical that people remember all these connections. What I think is important to point out is that the thalamus is deep in the brain, and there's a lot of different connections that it has. So when you stimulate this area, you can make it less likely for seizures to just spread and do their thing. And by doing that, you can reduce the patient's seizures. The patients who can benefit from DBS, patients who continue to have seizures despite trials of 2 or more seizure medications. There's a wide variety of patients with epilepsy who can benefit. And this is an important thing. Some of the tools out there, you have to have very well localized seizures, but with deep brain stimulation, you can have patients who have very focal seizures, with seizures coming from multiple areas of the brain, and even more widespread seizure activity. So this is kind of a cartoon on generalized seizures versus focal seizures. So I think these are, so the deep brain stimulator can help a lot of different patients. Meanwhile, some of the epilepsy surgeries, you have to pinpoint where in the brain the seizures are coming from. You have to say it's coming from exactly this area, so the surgeon can remove that area. Or there's other devices out there that you have to be very precise. Good news is the deep brain stimulator. Some patients who've been told you can't have surgery because we can't localize your seizures, deep brain stimulator is a good answer for them. The outcome, seizure activity can typically be reduced by about 70% in patients. And so it does take time. And one thing I always like to tell patients, it's not likely for the deep brain stimulation to stop your seizures. So I've had some patients say, oh, I want to get that deep brain stimulation because I want to drive or I want to be seizure free. Unfortunately, it's a very powerful tool. And there are some patients who do become seizure free, but it's not an expectation. The main expectation is seizures will be reduced in frequency and intensity. It does take time, and we'll show you some graphs on that. It takes time. Over the years, it actually gets better and better with the seizure control. Another positive thing about deep brain stimulator is that the seizure medication, so anti-seizure drug dosages and numbers of medications can be reduced. Here's some data on how the seizures, this is responder rate, is 50% or greater reduction in seizures. And so the number of patients, so the percentage of patients who had a good response, this is some of the numbers. So 43%, 54%, 56%, somewhere around 70% are considered to have a good response to seizures. So just remember that piece. The risks of DBS. So I've talked about some of the good things. DBS can reduce seizures, can help with reducing the number of medications, and these are all the good things about the DBS. But remember, this is a surgery. It can be a device that it's placed in the brain. So you're getting burr holes placed. This is going deep in the brain. And so you can have things like infection, bleeding, even stroke. So just be aware that, like all procedures, it has its risks and benefits. Some of the serious adverse events, infection, 10% of patients had some sort of an infection. So another problem is it's very, you got to hit that target in the thalamus, and sometimes the target gets missed. And about 1.8% or less for kind of major effects. Stroke is always a risk in brain surgery. So even though this is not commonly reported, it's certainly something that you have to kind of consider. So the way the device is programmed is the physician will make adjustments. So what happens is the patient will get the device placed, and then the patient needs to come back for further adjustments on the stimulation. And the physician can set the programmer to stimulate the patient at a certain frequency and intensity. And you can have a device where you can turn the device off, so the patient can have this at home, and then the patient can check their battery, can log seizures, and you can actually stimulate. You can actually use this program with a patient's getting an aura. You can actually stimulate the deep brain stimulator with this programmer. Overall satisfaction at 5 years, 75% of patients chose to continue DBS therapy, and 73% indicated that they were satisfied with the DBS therapy. So in summary, DBS can be a very effective device for reducing the frequency and intensity of seizures, and patients with a wide variety of seizures can be helped with the DBS. So these are some of the good things. The other thing I always like to talk about is many of my patients have tried so many different seizure medications, and those meds have toxicity to them. They can make you sleepy, they can affect your thinking, but the DBS would be like a seizure medication, but without those sedating side effects. Again, always remember the deep brain stimulator is a surgical procedure, and that you have to realize that there can be some risk to to the procedure. You really want to talk about the details of the surgical impact with the surgeon. So thank you, and please see the Minnesota Epilepsy Group website for further information. Thank you for watching this video.